Hello guys, this video is about the pectoralis major, and in my previous video I was talked about the pectoralis minor. This is pectoralis major. For the pectoralis major, firstly I will draw the diagram. This is the manubrium. This one is the clavicle. This is the clavicle. There is the first rib. This is our first rib. This is second rib. This is third rib. This is fourth rib. This is fifth. This is sixth. This is seventh. It's the seventh, and there is 8, 9th, 10th. 8, 9, 10 join the 7 costal cartilage, and 7th costal cartilage articulate with the sternum, and there is 11 and 12. Here this is the acromial process. This is the acromial process. This is the coracoid process. This is the scapula. This is the scapula. This is the scapula. And there is this is the humerus. This is the greater tubercle. This is the lateral lip of the greater tubercle. This is the lesser tubercle. This is the medial lip of the lesser tubercle. This is the costochondral junctions of the ribs, or we can say costals. These are the costochondral junctions. Firstly, pectoralis major muscle have clavicular fibers, first clavicular fibers, then second is sternocostal fibers. स्टर्नोकॉस्टल का मतलब वो फाइबर जो स्टर्नम से अराइज होंगे, एंड कोस्टल मीन्स रिब से भी अराइज होंगे. दोज फाइबर आर कॉल्ड स्टर्नोकॉस्टल फाइबर्स. एंड थर्ड फाइबर्स arise from the aponeurosis. That's why it is called aponeurotic fibers. Aponeurotic fibers. So clavicular fibers will origin from the middle two-third of the anterior surface of the clavicle. This is our clavicular fibers. Clavicular fibers will origin from the anterior two-third of the medial two-third of the anterior surface of the clavicle and lateral half of the anterior surface of the manubrium. Lateral half of the anterior surface of the manubrium, and sternocostal fibers arise from the lateral half of the sternum, lateral half of the anterior surface of the sternum up to the sixth costal cartilage. Up to the sixth costal cartilage. Lateral half of the sternum up to the sixth costal cartilage. These are the origin of the sternal fibers, and one part is left. This is costal. Costal means from the second, third, fourth, fifth, sixth costochondral junction. From the second to sixth costochondral junction, these fibers arise from the sternum, half of the sternum, lateral half of the anterior surface of the sternum, and costal part arise from the second to sixth costochondral junctions of the costal, means ribs. These are the origin. And some are aponeurotic fibers. Aponeurotic means flat tendon. There is the aponeurosis. These are the aponeurosis. These are the aponeurosis of external oblique muscle. External oblique muscle. Aponeurotic means fibers which arise from the aponeurosis of the external oblique muscle, which is the abdominal muscle, and outer side muscle, that's why it is called external. External means बाहर की मसल है, और कहाँ की? ओब्लिक मीन्स ओब्लिक जा रही है, इसलिए इसको ओब्लिक कहा, और है कहाँ की? एब्डोमेन की मसल है, दैट्स व्हाई इट इज कॉल्ड एपोनेरोसिस ऑफ द एक्सटर्नल ओब्लिक मसल ऑफ द एब्डोमेन. एंड सम फाइबर्स अराइज फ्रॉम द एपोनेरोसिस ऑफ द एक्सटर्नल oblique muscle. These fibers are called the aponeurotic fibers. These fibers arise from here. These aponeurosis fibers, and these are the sternocostal fibers, are joined together. All fibers are joined together. These manubrium fibers and clavicular fibers, these all fibers are joined together and insert into the lateral lip of the bicipital groove of the humerus. This is the lateral lip of the bicipital groove of the humerus. These fibers will insert into the lateral lip of the bicipital groove of the humerus. These are the origin and insertion. These all fibers are inserted into the lateral lip of the bicipital groove of the humerus. This insertion is bilaminar insertion. Bilaminar insertion. Bilaminar insertion means these are the two lamina. This is the anterior lamina and this is the posterior lamina. Anterior lamina में फाइबर्स आएंगे, क्लेविकुलर फाइबर्स एंड मेनुब्रियम से जो फाइबर्स निकल रहे हैं these fibers are inserted into the anterior lamina. These fibers are formed the anterior lamina. एंड लेफ्ट जो बच्चे कौन से स्टर्नोकॉस्टल फाइबर्स एंड एपोन्यूरोटिक फाइबर्स, दीज फाइबर्स आर insert into the upper part of the posterior lamina. These fibers are sternocostal fibers and aponeurotic fibers, and clavicular fibers and manubrium, जो manubrium से निकल रहे हैं वो fibers, these are inserted into the anterior lamina, and sternocostal and aponeurotic fibers inserted on the upper part of the posterior lamina. This type of insertion are called bilaminar insertion, which is found on the pectoralis major muscle. Now nerve supply of the pectoralis major is same as the pectoralis minor, lateral and medial pectoral nerve. Lateral and medial pectoral nerve. Lateral pectoral nerve is the branch of the lateral cord of the brachial plexus, and medial pectoral nerve is the branch of the medial cord of the brachial plexus. Now action of the pectoralis major is, firstly, these clavicular fibers will flexion at the shoulder joint. Clavicular fibers help in the flexion at the shoulder joint. These fibers are the clavicular fibers. These help in the flexion at the shoulder joint. These sternocostal fibers and aponeurotic fibers, these fibers are help in the adduction means towards the midline, adduction at the shoulder joint and medial rotation at the shoulder joint. These fibers will help in the, these two fibers will help in the adduction at the shoulder joint plus medial rotation at the shoulder joint, and these clavicular fibers will help in the flexion at the shoulder joint. Clavicular fibers are also called the anterior fibers of the pectoralis major muscle. So this is all about the pectoralis major muscle. If you like my work, then please like, share and subscribe my channel. Thank you very much.